Hi everyone, this is Jeremy Ligaria, your student nurse from ACT. For today's video, I'll be showing to you the procedures in how to properly assess the hair, the skin, nails, eyes, ears, nose, mouth, throat, sinuses, head, and neck. But before we formally start the assessment, here are the materials that we'll be needing for the assessment. Good afternoon, ma'am. I am Jeremy Ligaria, your student nurse from ACT. So for today, ma'am, I will be assessing your hair, your skin, your nails, your eyes, your nose, your mouth, throat, and sinuses. For verification, ma'am, may I check your ID band? Okay, thank you. So what is your name? Okay. Your age? When is your birthday, ma'am? Okay, thank you. Is it okay na hold certain parts of your body as part of the assessment? Okay, ra? Okay, thank you. So before we start the assessment, I will be performing hand hygiene to prevent the spread of microorganisms for a while. Rest assured, ma'am, that all informations and documents that will be gathered during the assessment will be kept confidential between you, me, and to the physician that I'll be referring to. So for a while, I will close the curtains to provide privacy. Assuming that I already closed the curtains to provide privacy for the patient. For the general appearance and behavior, everything is just normal. The patient is well-groomed and alert, oriented, and attends to the questions and responds appropriately. The patients also maintain eye-to-eye contact. Her expressions are appropriate to the situation, and the patient is comfortable with me and interacts pleasantly. And she also behaves accordingly with her age. Before we start the assessment for skin, ma'am, I'll be asking questions about your past history. So, do you have skin problems or skin disorders? Nakay mga problema sa imong panit? Okay, thank you. Do you have rashes or oiliness of the skin? Rashes? So, are you experiencing any pain, itching, or numbness? Okay. Are you taking medications? Okay, thank you. Have you had any hair loss or change in the condition of your hair? Okay. So, let's start with the assessment of the skin. So, this will include inspection of the skin color and palpation for the moisture, texture, mobility, and skin turgor and temperature of your skin, and if there is primary or secondary lesion present on your skin. So, can I hold your hand as I will check the color? Okay, thank you. So, the color of your skin is light brown and it is evenly distributed throughout the body except for those areas that are not exposed to the sun, like your palms and soles of the feet. Now, let's examine the skin turgor. So, I'll be pinching your skin and I will hold 3 seconds. Okay, thank you. Your skin has decreased turgor, wherein it remains elevated after I pulled up and released. So, this indicates that you are dehydrated and it is a sign of aging. So, my advice to you is to drink a lot of water so to avoid being dehydrated. Okay? So next is I will palpate for the texture of your skin. Number 1. Okay, based on my observation, the texture of your skin is not too oily, But I observed some primary lesions on your skin, like this one. You have nodules with at least 1 centimeter, and you also have spots on some areas of your body, like your face, your arms. Next, I'll be inspecting your hair and your nails. Can you give me your hand? Okay. Your nails are well groomed and clean. Other one. It has a pink tone color, no? The nail plates are firmly attached to the nail bed. Okay. Next po, I'll be inspecting your hair. So I don't observe any parasites on your hair. There are no lice. There are no neat spots. And I don't observe any alopecia on your head. I'll be assessing your head, and for me to be able to do that, I have to touch and palpate certain parts of your head. Is it okay with you? Okay, that's great. But before I inspect and palpate your head, let's have a quick health history about you. So, do you have headaches? Okay. Can you describe for me how that headache feels? Is it kanang naglagiting ba? Unsa man siya nga klase nga sakit? Okay, thank you. So, when did it first begin? Kanus na siya nagsugod? Okay. So, where does your headache begin? Can you point for me where exactly it occur? Pwede mo tudloon sa ako sa dapit mo suol imong sakit sa ulo? Sa dapit? Okay. So, how long does it last? Unsa may gidugayon sa pagsakit sa imong ulo? Pila ka minutes?
5 minutes.
Okay. So, how severe is the headache? If we will rate it from 1 to 10, as 10 is the most severe, asa man ang sakit, ug atong i-rate gikan 1 hangtod 10? Okay. So, what pain relievers best work for you? Unsa man imong tambal ani? Na ba kay gitumal? Okay, thank you. So, do you have any other symptoms aside from headache, mga nausea, vomiting, suka, nana? Wala? Okay, thank you. So, do you have difficulty moving your head? Lisod ba ka o sa imong ulo? Okay. So, have you noticed any lumps or lesions in your head? Kabantay ba ka nga may mga bukol-bukol sa imong ulo? Okay, thank you. So, for the family history, is there a history of head cancer in your family? Okay. Is there a history of migraine headache in your family? Okay, thank you. So, for lifestyle and health practices, do you smoke? Do you smoke po? Nanigarilyo ba ka? Okay. Do you use alcohol or recreational drugs? Mga ilimnon? Okay. Let's start with the assessment of your head. I will be palpating your head to check for consistency, and I'll just observe your scalp. Okay? I'm just doing it posteriorly. Okay, ma'am. I don't observe any lesions on your head. I don't see any parasites or lice on your head, and there are no nits present. And your head is normocephalic, which means that it's appropriate with your body, and it is hard, round, and symmetric. So it's just normal. I will palpate your temporal artery and temporomandibular joint to check for tenderness if there's any. So, can you wipe? Right? Okay, wait again. Okay, for your temporomandibular joint, say ah. Okay, thank you. I don't observe any tenderness. And do you feel pain when we do the assessment? Sakit ba to pag hikap? Sakit? Okay, thank you. Kindly extend your neck, ma'am. Okay, your neck is symmetric with your head. There are no enlargements, no lesions, and no masses on your neck, so it's all normal. So next po, I have here a glass of water, and all you need to do is just take a sip of it and hold it in your mouth and then swallow if I see. So, okay. Ayaw sa tunla. Okay, then extend your neck. Okay, extend. Dito tunla palihog. Okay, thank you. So, okay na po. So, all cartilages on your neck are working well. The thyroid and cricoid cartilage, no, move upward symmetrically as you swallow the water. Next po, I'll be palpating your cervical vertebrae, your trachea, and your thyroid gland. And I'll be doing it posteriorly. Okay? Okay, your cervical vertebrae is palpable and visible. Next, I will be palpating your trachea. So your trachea, ma'am, is at the midline. Next po, I'll be assessing the range of motion of your neck. Kindly look up toward the ceiling po. Look down the floor. To the other side and to the other side. Okay? So, do you feel any pain while doing it? Sakit ba ang liog pag lihok nimo? Okay. Thank you. So, it's normal since you don't feel any pain when moving your neck. So, next po, I'll be auscultating your thyroid gland. Kindly extend your neck po. Okay, I don't observe any roots on your thyroid gland. So, next po, I'll be palpating your lymph nodes. Okay? Your regular lymph nodes. Okay, your cervical lymph node. Okay, so there are no enlargement of your lymph nodes. I don't observe any masses on your lymph nodes, so it's all normal. Next part of the assessment is your vision or your eye. But before that, let's have an inspection and to be followed by the test that will help to test your visual acuity. So first po, I have to inspect your eyebrows and eyelashes. Can you raise your eyebrows like this? Raise and down. Can you blink for me? Blink. Okay. So, based on my observation, no, your eyebrows, the hairs are black and it is evenly distributed to each side, same as your eyelashes. There are no lesion. I don't see any lesion on your eyelid also. Okay, so for your eyelid, you can easily blink your eye and I don't see any discharge or lesion on your eyelid now. So next, I will be inspecting your lower conjunctiva. Okay, allow me to touch your eyes. Okay, do you feel itchiness spot in your lid margin, katol? Wala, okay. So, I don't see any abnormality since your lower conjunctiva is pink and it's clear. Okay. Next po, I'll be inspecting your sclera. Okay. Using this pen light. Can you open your eyes po? So, your sclera is clear and white. So, I don't see any problem with it. Next po is your iris. I'll check the position and the color of it.
Okay, it is proportional to the size of your eye. It is round and it is brown and it's symmetric. Next, I'll inspect your pupil for the size, shape, color, reaction, and accommodation. Okay, your pupil are equally round, it's black, and it's also reactive to the light and accommodation. They are equal in size and symmetrical.
Next po, I'll be checking the movement of your eye. I have here a ball pen and all you need to do is to follow where it goes, okay? Wala ra kay pangutana? Okay, thank you. Okay, thank you. Your eyes move in a conjugate fashion and I don't see any problem with it. You can move your eyes with no difficulty. So for the visual acuity, so you will be tested using the Snellen chart which I posted on the wall. So this test is called the distant visual acuity. So I'll be pointing some of the letters and all you need to do is to read it. Okay? Okay, Ra? So I'll be requiring you to stand since this test requires 20 feet distance from the Snellen chart. Okay? This test, you need to read it with both eyes and then covered one and then you will cover the other side. Okay? Let's start. Okay, kindly read it with both eyes now.
A, C, E, E, O.
Okay? It's okay? Then let's cover. Please cover for me. Okay?
A, C, B, L, C, Tau.
Okay, it's okay, ma'am. The other side.
B,
Okay?
C, E, I,
Okay?
N.
Okay, it's okay, ma'am. So your score for the visual acuity for reading the Snellen chart for both eyes, you have a 20/30. Then when you cover the other side, you have 20/25, same as to the other side. So let's proceed to the next test, which is the field of vision. So I have to cover the other side, no? And observe if there are movements to the uncovered one. The other side. So I don't see any movement to your pupil, no? So it means they are aligned. So that's good to know. Okay, thank you. So next is the assessment of the ears. So before we start the assessment, I'll be asking past history about your ears. So do you have any recent changes in your hearing? Sabi ko usaban sa iyong pandungog? Okay. Do you experience any roaring or crackling in your ears? Okay. Thank you. For the personal health history, have you ever had any problems with your ears such as trauma, infections, or earaches? Sa dalunggan? Okay. So for the family history, is there a history of hearing loss in your family? Okay, thank you. For the lifestyle and health practices, do you work or live in area with frequent noise or continuous loud noise? Okay. So let's start with the assessment, and first I'll be inspecting your external ear structures. Okay, touch your ears.
Ears are equal in size. You also have elongated ear lobes, and they are parallel at the same time, and it's proportional to the size of your head. There is no lesion, discharge, and discolorations of your ears, and the color of it is consistent with facial color. Since I don't have an otoscope, I'll just use my pen light to inspect the auditory canal and the tympanic membrane. For the normal findings of auditory canal, there is a small amount of odorless cerumen or the airwax, and the cerumen color may be yellow, orange, red, brown, gray, or black. And for the canal walls, it should be pink and smooth without nodules. For the tympanic membrane, it should be purely gray, shiny, and translucent with no bulging or retraction.
Now I'll be performing a test. This test is called a whisper test. And I'll be saying a word or uttering a word, then all you have to do is to repeat after me. Okay? Na ko itabi nga words, dayon itabi niyo mo sa kuha kung unsa imong nadungog. Okay ra? Okay. Can you cover your one ear for me? Okay. Please repeat. Okay. Cover the other. Cover. Okay, thank you. So, based on the results, you are able to repeat the words that I say, but you lost your hearing and it requires follow-up testing by the audiologist. Next po is the assessment of mouth, nose, throat, and sinuses. But then again, before we start the assessment, I'm going to ask several questions about your past history. Okay, do you have experienced tongue or mouth sores or lesions? Lesions sa dila? Do you experience redness, swelling, or bleeding of gums? Dugo imong gums? Okay. So, how long has been this happening? Unsa man ning gidugayon nga nagdugo imong nga kuan, gums? Mga pila na ka days? Okay. Do you have any toothache? Sakit sa ngipon? Okay. Have you lost any permanent teeth? Mga ngipon nimo naigta na ngipon? Okay. So, do you have pain over your sinuses? Dapit din hit? Magsakit imong dilay dapit? Sahay. Next po, I'll be assessing your nose and check if there is any problem with it. Okay? First, I'll be inspecting the external structures of your nose. Okay, thank you. Do you feel any pain? Sakit? Okay. Thank you. So, for the color of your nose, no? It matches with the color of your skin. It is light brown. And then, your nose is smooth and symmetric with no tenderness upon palpation. Then, your nasal mucosa are dark pink and moist and free of exudate. Then, your nasal septum is intact and free of ulcers and lesions. And then, your middle and inferior turbinates appears dark pink and free of lesion. Next po, I'll be palpating your lips. Is it okay for me to touch your lips po? Okay. Okay. Based on my observation po, your lips is smooth and I don't see any lesion. But your lips have paler color. Next po, I'll be inspecting your mouth. Kindly say ah. Ah. Ah po ah. Nagkaon nga please. Okay. Thank you. So, based on my observation po, you have yellowish or brownish teeth. I also observed that there are decayed areas on your mouth. For your tongue and gums, there are no lesions and it is pink and moist. For your tongue is moderate size with papillae and it is at the midline. So for your ventral surface of the tongue, it is smooth, then it is shiny, also it is pink, and there are veins, I can see the veins, and also there are no lesion present on your tongue. Okay? So now I'll be inspecting the strength of your tongue. And can you do this po? This side. Upper. Okay, thank you. Okay, I have here a sugar and a salt, and I will going to test the ability of your tongue. Okay? So you will tell me what it tastes like. So can you tell me? Unsay lasa? Okay. Unsay lasa? Okay, thank you. Proceed to the assessment of your sinuses, and I'm going to palpate your frontal sinuses and maxillary sinuses. Is it okay with you? Okay, thank you. Okay, your maxillary sinuses. Okay, thank you. So your frontal and maxillary sinuses are no crepitus as I palpated. And then your sinuses are non-tender on percussion. Okay, thank you so much for your cooperation and thank you for your time.